Hey, I'm Dr. Kelly Starrett with the Ready State. I'm going to give you 2 strategies to help improve that jammed finger. Now, you're already on the H-wave tip, so you're decongesting. You might have been using some of those pads to help manage some pain in this area. But I'm going to give you 2 other strategies. One is just going to need a rubber band. This is just kind of a strip of rubber like TheraBand. Cut it to be about 1 centimeter, maybe 30 long. This could be a bunch of big, thick rubber bands tied up and cut together. And the other is a magic marker. Now, the first thing we're going to do is give ourselves some manual compression when we can't be pumping using sort of the natural drainage system. When we have a jammed finger, one of the things that happens is a lot of the pressure that makes it so uncomfortable is a result of the fact that swelling gets caught below these little kind of creases in the finger. And so one of the nice things about just having this rubber band is that I can go ahead and just compress it. I'm just going to wrap that thing tight like a nice kind of sausage burrito sandwich here. Compress that thing down like a python and then just leave it on for a minute or so. If I could elevate it above my heart, better. But what's happening is that big mechanical compression is going to drive some of that swelling out beyond those little limitations of those retinaculum, those little bands of tissue here. The only rule for this always is no numbness and tingling. So if your finger starts to get numbness and tingly, stop. So pop it off. And what we tell our athletes is, hey, let's try to get 1 minute of compression 30 times for the day. And that's going to get you a big fat C grade. So what's going to happen is that I'm going to compress this and then release it, catch my breath, wait another minute, compress, release. And I can do this while I'm, waiting for something, on the call, reading an email, watching the TV. And it doesn't even have to be consecutive. I could go many minutes in between. But when we begin to get regular amounts of just manual compression on this finger, what ends up happening is we can sort of jumpstart the significant removal of this waste, which means we're not going to be rate limited by swelling and we're going to be able to get more blood flow into the area. Now, even if the system is really badly sprained, we're still not going to do any damage to those tendons and ligaments. In fact, we're going to help them heal. So don't be a panic if you've got but it might be really bad. We're just adding some compression wrapped to your comfort. Believe it or not, even a broken bone can be splinted this way. So even if you've broken a finger and you're in the splint, you could still add this compression. Always, if the compression is hurting you, make it less gnarly. And what you'll begin to see is that you get ahead of that swelling, and lo and behold, you can take some pretty significant compression. So it's hard to compress this finger. But what you see is that just buddy taping it, putting by your hand, by your side, may not be the best way to remove some of that swelling. And you will see that the better you're able to manage the congestion in the finger, you're going to have less discomfort in the system. The second aspect is realizing that, hey, this is a movement system, and that if I work on some aspect of the movement system, I can actually help desensitize that mechanic. Because even though I may have disrupted or sprained some aspect up here, if I can change what's going on down below, I can maybe desensitize that finger. So if you take that marker, this is just a dry erase marker, I can put it into the meat of my hand. I can load that up and I can just add a little motion. And if you push on any aspect of this palm in the meat here and it's uncomfortable, you have found some aspect of the movement system that can be improved. You can take the tip of that and you can actually just rub it between the bones on each side. So I've got, say, this is the bone between my middle finger and pointer finger. I'm just going to find a spot in here and just rub back and forth. And if I find a tender spot, I just stay here with appropriate pressure, and I'm going to rub this for 30 seconds until it starts to desensitize, and then I'll keep moving on. And the combination of H-wave plus some compression plus a little bit of manual work where we're going to work on any sensitivity in the actual musculature that drives the system, you'll be shocked at how much better you can feel and how much faster you can get over that jammed finger.